Mayor Ted Green. Want to welcome all of you who are watching us on Facebook, Instagram, on YouTube. Want to welcome you to our town hall meeting, our 17th week. We are excited about today's meeting. We have our very own with us, Councilman Mustafa Brent, who is the 5th Ward Councilman. And not only that, he is going to give us his testimony today on being a COVID survivor. So we're excited about that. We also have Dr. Griffin with us and Dr. Mehta. We've been here for 17 weeks giving you updates, but tonight we ask you just to hold on just momentarily till we get started. Again, hello everyone, this is Mayor Ted Green. I'd like to welcome you to our town hall meeting tonight, July the 16th. We're going to get started momentarily. We're waiting for those folks to get on our phone lines and waiting for folks to get on the Facebook, and we're going to start.
Okay, good evening, everybody. Again, welcome to tonight's telephone town hall meeting. For those of you who have joined, you can press 1 to ask a question. Press 0 to ask a question. If for those of you who are on Facebook or Instagram or anywhere in social sphere, you can call 862-213-3758. That's 862-213-3758. And again, feel free to press 0 to ask a question. Mayor, we have 583 people already on. Well, 600. You can begin.
Wow, thank you so much, Ray. So again, good evening, everyone. This is Mayor Ted Green, and I am very honored to welcome all of you back to our East Orange COVID-19 Virtual Town Hall meeting this evening. We are honored and blessed tonight with my good friend, Mustafa Brent, who is our councilman of the 5th Ward and also a fire captain. And we are blessed to really have a conversation tonight about COVID-19, where we know in the last 17 weeks, many of our individuals, like our family members, friends that we know, have been affected with the COVID, and those who have survived. Tonight will give everybody an opportunity to really hear about his experience and the things that he went through. So we're looking forward to having that conversation with Councilman Mustafa Brent from the 5th Ward. But before that, we're going to just give the numbers out very quickly tonight. What Dr. Griffin is going to talk about some of our testing sites and some of the things that we should be doing as we open up throughout the city. Dr. Mehta, who is from the Eastern General Hospital, will be talking about some of the things that they're doing over there. But very quickly, let me just give you the numbers for today. As of today, July the 16th, we have confirmed 2,204 positive cases in the city of East Orange, with 219 resulted in deaths. Here is the ward breakdowns. I'm going to give you the ward breakdowns very quickly. In our first ward, we have 310 cases. In the second ward, we have 364 cases. In the third ward, we have 448 cases. In the fourth ward, we have 451 cases. And in the 5th Ward, 438 cases. Now, in Essex County alone, there are 19,100 positive cases and 1,830 resulted in folks passing. In New Jersey alone, the positive cases are 176,278, with 13,660 individuals who passed. So again, East Orange, as we continue to wear those masks, practice social distance, making sure we wash our hands and all the way up to our elbows for 20 seconds. We cannot get lapsed in thinking that because the numbers are dropping a little, we're still concerned about our young people, and we're going to talk about that tonight. So before we get started, also while folks are on, just want to give you a brief update on the East Orange School District. The East Orange School District will be having a meeting. I know there's many parents and folks out there concerned about what's going to happen in the up and coming year. Today I had an opportunity to meet with our new superintendent today, and we had a great meeting. The meeting was around reopening up our schools, and we're looking forward to that Tuesday, July the 28th at 6 p.m. To 7:30. The superintendent, along with board member Terry Tucker Swanson, will be joining us. Dr. Griffin will be joining us, and also you'll have some folks from the board members be joining us, and I will also be a part of that conversation, talking about how we're going to reopen our schools. So again, I hope everybody join us. And also tonight we have folks from the Board of Education that's online that will be answering some of the questions. But tonight is not only about the reopening of the school. Tonight is we want our conversation to kind of be around my good friend Mustafa Brent. Mustafa Brent, welcome, man. How you doing?
Thank you, Mayor. Thank you, Mayor.
Good, good.
Before you guys get going, let me just remind folks online, you can dial 862-213-3758. That's 862-213-3758. Thank you.
Thank you, Rachel. So with that, I'm going to jump right into a conversation with our councilman. Councilman, we have been doing what we're doing now for 17 weeks, you know, and you've been a part of it because you're on council. But tonight's conversation is, I know that when this COVID thing first broke out, right, and all of us we had some questions, we had some concerns and things of that nature. And as of today, I know that you have experienced COVID-19. And if you could tell the folks from the beginning, knowing that you had COVID, what was your symptoms, and what was some of the things that you went through during that period, and how you felt.
Thank you, Mayor. I want to start off by thanking you for having me this evening, and your administration, and Dr. Griffin and Dr. Meta for being here. And as a point of housekeeping, I want to thank God for affording me an opportunity to continue to be here and to serve within the capacity that I'm in. I want to thank East Orange General Hospital as well. The president, Ms. Paige Bowick, and even my good friend Steve reached out to me, Sambito, to check on me. And it just was, from that standpoint, I got a lot of love and a lot of support from Dr. Griffin, from Dr. Meta. I honestly thought that it was because of who I was that I got the kind of attention that I got, but I was happy to know that there were other people that in the eyesight of the public, but maybe of a lesser stature within, to receive the same type of caretaking and attention. And I think that is commendable to your leadership, as well as the people that you surround yourself around within the city, from the leadership within our health department. And so my experience, I have no problem telling people, it's very spiritual in nature and in application. And so I initially started off as the individual who was sounding the horn. I was talking to my counsel. I had bought my mask back in November. I was, online watching news feeds and so on and so forth. And so I initially began to have symptoms. I thought it was my blood pressure. I had a headache, I felt pressure, I felt woozy, I felt a little sick, and then it slowly began to progress into a thing of me not having, I gotta look at the camera? All right. Me not having the ability to think. I lost my sense of smell and taste. I had body aches, body chills, headaches, and so I thought I was getting the flu. And so I told my wife, who I have to give a shout out to, and all of my family, really, my wife, Karima Williams, and my 5 children, for being supportive and taking a proactive role initially as well, and throughout the duration of my illness and all of the things that I was going through. And she jumped right on it. She started with a lot of the holistic medicine in conjunction with some of the things that Dr. Griffith and the doctors at the hospital were telling me to do, the vitamin C. She put me on the black seed, the elderberry, ginger, and all of these things, just natural holistic things to keep my immune system boosted while they work through different platforms of medicine to apply to the various illnesses and symptoms that I was exhibiting. And so my wife, she was like, we're not going to accept that. We're just going to keep pushing. We don't want to say it's COVID. And so I got tested. And I got the call that I was positive.
Right.
And at first I was a little taken back. I was a little distraught. I'm not gonna lie. And there was some relief because it was an acceptance of what was transpiring, and so I had something a point of reference to work from. And so we started doing a lot more. I lost my appetite. Like I said, I lost my sense of smell and taste. I couldn't stand, I couldn't sit, I couldn't move, I couldn't walk, I couldn't do a lot of things. And so it began to affect me, mentally and emotionally. And so I went through that for about maybe like a couple days. And then I thought I was getting better. I said, wow, I felt my energy get up a little bit. And then I developed like a cough. And then I started coughing up, this like dark colored mucus. And I was like, oh, thank God. God is purging my system of this illness. And then I woke up one day and I couldn't breathe. And I was like, wow. And I said in my mind, the bravado of being in the fire department, always being the strong person, always being the person that people lean on. I said, you know what? You just overreacted. Don't give in. Be strong. And I waited a little while. I think I waited about a day. And then the next day I woke up and it had gotten worse. And I reached out to Dr. Griffin, who reached out to the other doctors. They told me to go into the hospital and get checked, and I went in, and they wound up keeping me, and I found out I had double pneumonia.
Right. So, and I'm glad you said that, because everybody really knows the person you are. You like working out, the physical fitness part, the spiritual part, but also your family. And what I want to ask, and I hear it quite often when folks are diagnosed with the COVID, it has to be a spiritual thing, because when you went into the hospital, your family can't go with you.
Right.
So how do you, two things, was you ever in denial? And secondly, how did you deal with it, knowing that when you went into East Orange General Hospital, because I remember when you went in, how did you deal with it knowing that your family couldn't go in there? And I know Karima's very strong, your family's strong, you have a strong foundation. How did you deal with that, knowing that your family couldn't come up to see you, and were you in denial for a minute, and how did you feel when you went into denial?
So I think initially for mine was like maybe a little reverse. It was acceptance, because of there's a lot of spirituality that goes into my daily deliberation, and I reflected on what it actually meant to me as a person for my development overall. But when I went into the hospital, I was under the mindset, I believe, like, this is going to be okay. Like, even if God calls me back, everything's going to be okay. But knowing that you're going to die and going through the process of suffering and waiting to die is two different things. And so as it began to set in the reality of what was transpiring to my body, and understanding, like you said, that no one could come. My family wasn't there. My children, I couldn't talk to my children. I remember even, praying out to God, saying, man, I can't even kiss my mama one last time, Lord. Like, just really, thinking about the reality of what it was. And then it became a thing of kind of like detachment, in a form of like,
right,
almost like, sorrow and depression, right? And I want to say that because there's a lot of stigmas that's associated with this disease.
Yes, it is.
You don't want to speak out in the beginning. You
right,
have a sense of, embarrassment. I went through all of those stages,
right,
embarrassment, a feeling of being irresponsible, a feeling of not taking that serious as I thought I should. And I was the one who was like sounding off the alarms in the beginning.
Right. And not to cut you off, and I'm glad you kind of used that term of embarrassment, right, Councilman? Because there's a lot of folks that's out there today that's on this Facebook, and that's on Instagram, and that's out on YouTube, right, that may have the same symptoms that you have, right? But they too embarrassed to say, should I go to the doctor, or should I tell somebody? How should folks feel if you have it, and you feel that you have it? should you feel shame for you? Because it's just, you know.
So
something that
you
people
have to go through the process, right?
Right.
I think the more people like myself and people look to for leadership and in a position of being in the forefront, come out and say, hey, this is a disease. You can catch it. Some people have passed away from it, but you can also survive and you can adjust and adapt. And I think my family went through a point of denial more than me because they were hopeful, right? And so it's necessary for people to have the conversation. If not for yourself and concern for your own health, and you want to be strong and, you know, exert, you know, I don't have to worry about that. I'm going to get through it. For the people that are close to that you love, that may interact with you, or maybe depending on you to help them in whatever they're doing in their life. And so it has to be a conversation of being real.
Right.
This is what's going on. This is a reality. Whether you believe that somebody planned it like this or whatever craziness, people are dying from this disease.
Right.
And we all have the responsibility and the capability to control it and to use preventative measures to get outside of it.
And I'm glad you said that, man, because, Councilman, because I think that every day from day one, we, especially here on our weekly meetings, we're stressing to our community how important it is to wear your mask, how important it is to still practice social distance, how important it is to watch the people that you go around. And that brings me to it. Once you left the hospital and you, your spiritual part, because I know that plays a part, because it plays a role in my life every day, right? And many of us probably in this room probably had a few times in our life that we thought we had it, right? Because of the, you know, the coughs, the sneezing, the chills. But I want to ask you, when it comes to when you came out of the hospital and you did get relief, you still had a process, right? You had to go home to your family. What did you do to really protect your family after you got home? Even though you was cured and you was treated, how did you adapt to making sure that, you know, the first lady at the house, Karima, your kids, because we know your family, man. How did you adapt to that?
So I want to just make a quick sidebar. The reality of it is that, you know, I tested negative, but what people don't realize and reflect on that, there are long-term effects of this disease, right? And I still have, and I'm not back at work yet. And my children have coined me like, you know, like Bigfoot, because I haven't been out in the public like people used to see. People say, I haven't seen you in a couple months. I'm like, yeah, you know, I almost died. My kids say, oh, here he goes, talking about that again. You know, I'm on the mend, but I still have, you know, existing, you know, conditions. I still have fatigue. I still have problems with my breathing. I have to get a CAT scan to, my doctor's concerned about my lungs and why my breathing capacity hasn't returned. So when I did return home, the reality is, okay, now that I'm virtually almost out of the woods, I was maybe like 55% when I left. You know, I still was losing weight. I put some weight back on now, thank God. Once I realized I could do 25 push-ups, I said, okay, I can get back. That was like a sign.
Yeah.
But then it was a concern about my family.
Right.
Because my wife had a cough. And, you know, she had to be strong for everybody. She was taking care of me.
Yeah.
She was making sure the children were okay. She was doing all these things. And eventually my family all got tested and all wound up testing positive. Right? My entire family, my wife, and my 5 children. I want to make that a statement because it's a statement of acceptance and it's not embarrassing.
Yeah.
Because I have a large family.
Right.
And my family likes to be around family. And people like to be around my family. And so the key preventative measure is if you know you have it, you can be more heightened in understanding what you need to do to prevent the spread.
Right.
And all of the cases that we do have, that you mentioned, of people who are courageous enough to get tested. There's thousands of people that haven't been tested,
Right.
that are asymptomatic, that don't show any symptoms, or think they just have the cold, or afraid to lose their position in their job, get laid off, or lose prestige or whatever.
Well,
and so it was definitely an adjustment period.
And I'm glad you told me you're getting a little stronger because I was going to challenge you on push-ups.
Don't
man,
do it,
but
brother.
I ain't going to do it right now because, you know, it seems like you're getting your weight back up, man. So, you know, but really I'm very happy that really you're doing well, Councilman. And I could call you my brother because, you know, we go a long way back. What I want to do, and I want to just kind of embark on this just a little more, the importance of people being tested, right? Being tested. this, like you said, there's still a lot of people who's watching this show still haven't went out because some type of myth that we have in our community. If I go get tests with the COVID testing, they're putting something in me. If I go get the asymptomatic test, they're putting something in me. From your perspective and your experience, how should we deal with that?
I mean, I think that for the most part, the education piece that you guys have been conducting on a weekly basis is a major part of it. I think that there should be more conversations from a communal standpoint and from a familiar standpoint as well. People need to have these conversations in their home. People need to sit down and go into, you know, the psychology of what's transpiring, because that's a side of the virus that we haven't even begun to really delve into, because we're still trying to get a grasp on what is going on actually, what are the symptoms, what are the mechanisms, what are the control, you know, mechanisms, and so on and so forth. And so, you know, we have to get out and have the conversation.
Right.
People have to get outside of the fear and realize that we're going to be in this for the long haul.
Yeah.
And if we all don't become more participatory in what's going on, then we're going to have a serious issue. So the town hall meetings like you have here, you know, the virtual things that a lot of my council colleagues and, you know, Dr. Griffin and the other medical professionals have been doing, you know, the periodicals that have been placed, and just people having real conversations like, listen, I may be the councilman, but I'm your neighbor. I'm your friend. I'm the guy next door. You ride down the street, you might see me doing my lawn. I'm a real person. And I literally was in the hospital, on the deathbed, texting my lawyer, updating my will. Texting my aunt to make funeral preparation, right? Making death videos for my children. Right. And so that was not just an act, it had a psychological and emotional effect on me as well. And
I'm glad you talked about the psychological, the emotional, the anxiety, depression, because I don't like to keep using that terminology. I know that even during these 17 weeks of my life, I lost my mom, right? But I lost my mom on March the 8th. March the 10th, I had to jump right into this COVID. Probably didn't have a full opportunity to grieve with my mom, you know, even though we know that in our lives that you know, God is the best knower.
That's right.
I didn't have time to do that. And maybe even me sitting here, I probably went through a depression stage or anxiety or stress. So how do you feel with those folks out there that probably went through that depression, that anxiety? Your spiritual side of you, Councilman, how did you deal with it? I know you talked about it earlier, but if you had to talk to folks out there today to say, you know, with this anxiety, especially those who have it. There's a lot of people out there today that's online, and we're going to take some calls, that had the COVID, and they survived the COVID. And there's a lot of people out there who family members died from the COVID, and they went through the depression, right? And there's people in the hospital right now going through it. How do you overcome it, and your spiritual side, how did you deal with it?
So, you know, I lost several family members and many friends that I've known my whole life that have passed away from COVID-19. And so it had an extra layer of reality for me. And so I believe, you know, everybody obtains a certain level of spirituality when they're about to die, right? And I think that's necessary as human beings for us to be more reflective and contemplative of what our existence is in this world. But we have not been placed on this earth in a vacuum. And I think we need to be more communicative with each other about what's going on. I think we need to be more connected. I think we need to reach out and just check on people. Like, I've gotten online and I've given out my number. I'm a public official. You can call me anytime.
Yeah, but I call you, never call me back, Councilman. I know it's no fact, but it's
You
okay.
call me, brother, it's a celebration. Oh, this dude called me? What?
Yeah, all right, yeah.
To our own pleasure. You know, but it's a thing like, you know, like I tell people, I love you guys, man. I love you guys, and I can say that with a clean conscience and a pure heart. And I understand and I respect the humanity of all of us. But if we don't talk about it, we need to have conversations that it's going to be all right. And if it's not going to be all right, how does that look? What type of space should we exist in the complexities of that fear? Because fear can be a thing that hinders us, but it can also be something that motivates us to find a cure, that motivates us to have the conversation, that motivates us to take the preventive measures so that our children inherit a world that is more understanding and comprehensive of what this reality is in which we exist.
And I want you to hold that thought because I want to come back to that. Hey, Rachel, do we have any folks on our telephone call?
We do. We have quite a few folks on our telephone
Come on,
call.
let me hear him.
Yes. As usual, I am going to start with some of our Facebook questions. And we have a Facebook question from Nurse Booksy Davis. And this question is for Dr. Griffin. With the community assessment being done and compared with previous interventions and a plan developed for the next wave, for example, can a nurse be assigned to each ward to assess outcomes and current needs and future needs?
That's a great question. We are actually working closely with East Orange General Hospital and the Healthcare Foundation of the Oranges to do just that, to evaluate and update the community needs assessment as well as prepare for the second wave, which we know is inevitable, but we know that going into it will be more adequately prepared for that. So we are considering, the most effective strategies given what we've been through over the past 3 months so that we can implement it at that time.
Great. And I'll do one more Facebook question. This is from Allison Frazier, and this is for Dr. Griffin. She says, the ward numbers don't seem to be going down. What are we going to do? What is the administrative plan to get the numbers down? Does it seem to be working?
That's a great question, and it's something that actually I was prepared to address because I think it's important to remind everyone that the numbers that we're reporting are cumulative. So when we look at the numbers, there are going to be changes, and yes, you're going to see, and we have seen, a difference in the numbers per ward, the number of positive cases per ward. But when we look as a whole, the numbers are actually decreasing across the city. And so that's what we're looking at. As far as the ward-specific interventions, we're also looking at that. Sometimes you have the variety based on the buildings and the number of buildings in specific wards, and so we have intervened to continue to communicate with the property managers, the buildings, to make sure that they're implementing and continue to implement the strategies and the guidelines related to cleaning. We appreciate all the feedback that we've received so far from the community when they see that something is a little off and buildings or areas are not doing what we have shared that they should do, or the state and the CDC has also provided information on. So we are looking at that. Currently, again, our numbers are decreasing, but this is the cumulative number that is being reported per ward every week. And we are going to continue to intervene should there be a specific outbreak in any area of the city.
Great. I'm going to bring Janice Gabardine in, who has a question for Mustafa about his experiences. So Janice, please ask Councilmember Mustafa Brent your question. Hello?
Yes,
Hello?
good evening, Ms. Janice.
Hi. I just want to make a statement and then ask the speaker a question. I heard you all speaking about the people not going to get the test, but when I talk to my circle of friends, there is a lot of lack of trust for government. And in our history, there have been cases where African American people have been used as guinea pigs. And so when I speak to my friends, they're talking about all of the things you talked about. They're probably giving us the virus. They're trying to, do something with an ulterior motive. So I think, it's something we still have to work on. But my question for the speaker was, is he aware at all as to how he may have contracted this virus? Because you hear people saying they were in their homes. They didn't even go out. They had food delivered to them, and they're contracting the virus. So I'm wondering if the speaker has an inclination of how perhaps he contracted this virus.
So,
Thank you.
I contracted the virus because I'm a people person. a week or so before I actually had symptoms, I was in D.C., then I was in Newark, and I was in New Jersey. You know, just day to day, I was at my job at the firehouse. My life is continuously engaged with dealing with people. And so I think, you know, to try to control the virus and its spread is important for the medical personnel to understand exactly where I got it. And I've had that conversation with Dr. Griffith in the past. It had to be somewhere between my work at the firehouse, you know, at being in D.C. or just being in the community. And a shout out to Newark Fire Department for being a very proactive, one of the most progressive, I believe, in our region as it pertains to dealing with the spread of the virus within the ranks of the fire department. I'm happy to be a part of the apparatus that they were so proactive and aggressive in taking care of it. But that being said, you know, it's really hard to identify and really kind of like quantify exactly where I got it from. My main focus and concern after I realized I did have it was to inform people that were around me and to have conversations for them to be checked out as well. And as far as it goes for the compensation of people, you know, being, you know, non-trusting of government, you know, you're always going to have that there. But the reality is that, you know, it's not about trusting the government. It's about trusting your body. It's about trusting your community and the people that you have been placed in leadership. The mayor, his administration, you know, in Newark, we have a mayor, Ras Baraka. In Irvington, we have our good friend, the mayor over there. We have our mayor in Orange. And I speak of these people because I've watched them over the past few weeks take a proactive stance. We have our governor who has been very transparent. We have the governor of New York who has been very transparent, who understands the importance of getting information out so that people can be aware and make a conscious and intelligent decision for their health and the health of the people around them. And unfortunately, I'm not trying to make a political statement. When you have people that have a responsibility overall for the well-being and the caretaking and the maintenance of our country, you know, taking this situation lightly, it's very scary, man. It's very scary to have conversations with family members, family who have died, and friends who have had people die.
Right. And Councilman, I'm glad you kind of said what you said, because that's important. You know, the myth of this COVID-19 rather, and this pandemic. But I want Dr. Mehta kind of to elaborate on that, because when folks say that, you know, who you've been around, if you take the test, they're putting it in there. So, Dr. Mehta, talk about, you know, the myth, right? People have a myth that if you go take the test, they're putting it in you. If you go through the asymptomatic, they're going to put something in you. Kind of like talk about that myth that, you know, that's not true. And you don't just catch it being in the house by yourself. You have to be somewhere or around someone or somebody's to contract it.
And I think that's extremely true. I was going to interject and say the exact same thing which Councilman Brent said very well, which was that it doesn't matter. You can get it anytime, and you do not know who you'll get it from. And it's not something that you'll get from a stranger. And that's one of the biggest things that we were educating within our hospital, is that it's not a disease that you're going to get it only from the patients. You can get it from your fellow colleague, your nurse, your fellow doctor, your environmental worker, anyone. And that's why the precautions that you take are throughout. Whenever you're meeting someone, whenever you're interacting with someone, you have to take precautions as though they are positive. I know it's hard to wear and behave like at that heightened sense of awareness, but this is what is needed right now. The other thing, and you know, it's sad, but the country does have a lot of history, and you can't ignore history, but we can't keep living in the past too. You have to trust the community. You have to trust the people who are leading you. And when you do the test, it is a swab that goes through your nose, and it is something that has to go all the way to the back of your throat, touch the throat, and get some specimens from there. And it's not comfortable. I'm pretty sure the councilman will tell you it's like one of the most terrible feelings. But that being said, that is what is going to tell you whether you have the virus or not. We have the antibody test, which is taking blood sample, This is no different than giving your blood for anything, whether you're doing a CBC test, like checking your blood counts, or whether you're getting a COVID antibody test. It's the same thing. But again, the trust factor has to be there, because at this point in time you can't sit at home because you lack trust and you're feeling sick, you're feeling miserable, but you don't want to get out there because you're just worried. That's a big piece of this.
Right, and thank you, Dr. Mehta. And I want everybody to know that's watching out here today, I know you think Dr. Mehta is a different guy. That's because he cut his beard off after 17 weeks, but it's the same guy. It's the same guy, all right?
I got a haircut too.
but let me and thank you for that. So I want Rachel, are there any calls? Any other calls?
Yeah, we have a few of them actually.
All right, let's bring them in right quick. Let the councilman dig in on these conversations about this pandemic.
I'm actually giving you one more from Facebook, a really good one.
Okay.
Bobby Hudson says, thank you, Councilman Brent, for sharing all of this info. Her question, or his question is, what kind of treatment did your family have to have?
So, and that's the scary thing about it, right? That people don't realize. So I had the most extreme version, probably that many people have, the loss of sense of taste and smell. I originally thought it was a neurological issue. I said maybe I had a minor stroke and I just didn't know because I was moving. Because you lose a sense of taste, you have a certain level of numbness. But my oldest son, he walking around with his shirt off, I don't get sick. He just was fatigued one day. He complained of a sore throat for a day. She had it. My wife had a cough for a couple of months. She had it. My two daughters didn't show virtually any symptoms. And so the scary thing is that people are moving like day to day and not realizing how it affects them, the people around them and their environment. They didn't take any treatment. My wife just went broke on all of the holistic things, and by the grace of God, that was enough for them. But that's maybe one of the rare cases, right? There's other people that may have, existing conditions that they don't even know about, that are exacerbated because of what the virus does to the blood system, what it does to the oxygenation of the body, and so on and so forth. And so I'm no expert. I don't know all of the medical jargon, but I've become like, somewhat of a COVID virus expert because I was trying to survive, but the first step of the treatment is prevention, right? And I want to bring that home and restate that, because I was talking earlier even to the Director of Public Works, and a shout out to our fire department and our police department and our public works and our DWP, or DPW workers, because they're the frontline workers, right? They have to pick up the garbage that people aren't wearing gloves to put out. They have to come and, remove the garbage from the garbage can that people haphazardly. You people are putting out garbage bags with those little baggies that you get from 7-Eleven, household items, and they have to go extra hard to remove this stuff. And they're out doing a phenomenal job, still keeping our streets clean, sanitizing our communities, and there's a lot that goes into it. And so, a lot of people are worried about, the testing, the treatment, and these are serious concerns, but that's above, my level of understanding. But what we can all do as a people, as a community, is be more proactive in the prevention.
Do you ever, and very quickly, do you ever fear that some of the symptoms that you had can reoccur? Do you feel that way, or have it? Right? Do you feel that it can, and you have any reoccurrence of the COVID? So,
like I stated earlier, I don't have any of the severe symptoms, but I still have the fatigue. I still have the diminished lung. I still have, I've developed a slight cough. I get a headache, and so on and so forth. And being, a fire captain, that's one of the things that prevented me from going back to work. I can't go back, and be in an environment, and not be at 100% working capacity. It's a danger to myself and a danger to the people I work with. And I have to say that the fire department has been very supportive of my sickness. I've gotten response from the Director of Public Safety, and also got a call from my chief, as well as a couple of the chiefs that I work with, and my workers. as well. But you know, I have a fear. I have a fear now. I'm gonna be honest with you. That's one of the side effects. You
Right.
always, it's like you create a post-traumatic stress
Yeah.
from it. You know, we were bringing in groceries. Every grocery was getting washed off. Every piece of mail was getting sprayed down with Lysol.
Right. Well,
Shoes
yeah.
were being taken
We
taken
become
off
phobia,
outside.
you know.
Clothes were being taken off
Yeah.
in the hallway. So
Yeah.
so
You know, I think that
it
even
seems
though-
extreme, but that's the reality.
No, but I think everybody's going through that phase. You know, those who have saw their loved ones affected, those who saw their loved ones who have transitioned, those who are you know, had been around somebody but they had to quarantine themselves for 14 days. We all going through it, man. The same thing that you are going through in terms of the mail, spraying it down. People come on my house, my wife probably watching, I'm spraying the couch down, spraying the mailbox down, spraying my shoes down. When I come in, you know, we take the shoes off. It's like you get into this frantic cleanest, something that our parents been telling us for the last, since we've been born.
Yeah.
Wash your hands, Mustafa, Brent.
That's
Take
right.
your shoes off,
That's
Mustafa,
right.
Brent.
That's
Don't
right.
sit on my bed with those dirty clothes, Mustafa.
That's right.
Watch your face, you just came from outside. And here we are living a life that we are doing it more than ever. Everything is sanitizing. You know, you get to hug somebody, you go home and be like, oh, man, let me take off these clothes. So I guess my question is that if you had to have a message, because what we're starting to see is that our young people, right, 18 years old through, 29, are now are getting affected, right? And if you had to send a message out there, which we've been riding this daggone train for the last 17 weeks, what's the importance? What would be your message to our young people? A message that they can feel it in their heart. Because sometimes things don't affect people until they affect somebody in their family or affect them. Then they realize, like, this is real.
Mm-hmm.
So what would you say, and how would you say how real this COVID-19 is?
I
This
think the
pandemic.
doctor had something he wanted to say.
Yeah, I was gonna say that when, and again, I'm gonna just say when Councilman was sick, he was one of the first people to actually get sick. And in terms of treatment at that time, we did not have much in terms of treatment. So we were giving, like, literally what we had known about the virus, which was very little, and we didn't even drugs that we do now, like convalescent plasma and whatnot. So it was truly, and it's, you know, you're absolutely right. Things have changed, and things will continue to change. So I just wanted to make sure that we are aware that he faced a very different world than someone who gets sick now.
Right. So and thank you, Dr. Mehta, for that. Councilman, if you can elaborate on.
So you know, the reality of the culture in which we exist, right? We grew up with the concept in our minds and in our person, you know, I'm not afraid to die, right? I'm ready to die, right? It's even a song that we grew up on, right? But what I say to my young people, how about a little courage in living, right? How about a little courage in exerting that same energy towards helping someone else live a vital and a vibrant life? And how you do that is taking this pandemic very seriously. People are not fake dying. They are not play dying. They are dying for real. And I put a post on Facebook, you know, everybody may not be afflicted, but everybody's going to be affected by this virus. I was at the teller at the bank, just having a conversation. Oh yeah, my boyfriend's father died from COVID. I was at the ShopRite. Oh yeah, my godson's, you know, aunt died from COVID. So everybody's being affected. And I think it's very, very selfish. Humanity demands that we be more of ourselves as it pertains to our concern for one another. It's very selfish to not take this disease seriously. And so I say to the young people within that demographics, live. Live for yourself and live for somebody else and give something back. Don't be selfish now and throughout the rest of your life, because when you reach an age of maturity like myself, after 40, when you come to realization that it's bigger than you, when you're sitting in a hospital under 3 levels of darkness, right? The hospital room was dark, I don't know why. It was warm and welcoming and comforting though, right? You know, I had the inability to reach out to my family. That was a level of darkness, right? And then understanding that there at the time was nothing that could be done. Doctors and nurses were frantically trying to help me to the best of their ability. And I'm sitting there like, yo, doc, what are you talking about? Do something. You're the superhero, right? And not being able to breathe. This is a different reality, right? Not being able to breathe, having oxygen in these things is a serious thing. When you come to that reflection and you know that the world is still spinning without you, you begin to understand that it's bigger than me. And I have to do more to help other people. So since I've gone through that experience, I'm conveying that message to you all. So I pray to God that you don't have to go through that experience or put somebody else in a position where they have to go through that experience, because it's not pleasant. It's not a comfortable feeling not being able to sleep. I was away. I wasn't able to be around my children for 2.5 months. For 2.5 months. She collapsed in my arms and was crying. She said, my baby, my baby. And I said, my mama. Right? Those are the things that you take for granted. But I had to go through that because I didn't want my mother to be sick. She's older. I didn't want her husband to get it. I didn't want my brother. I just went and visited some of my family members because, like I said, I had a death. My uncle passed away, and I was able to see them after months. Yeah. And they were still, apprehensive.
Yeah, I mean,
respectfully. So my,
right.
I love you. And I'm like, I love you too, but I ain't trying to give you his Roni.
Right. And I'm glad you talked about that, Councilman, because I think as this thing continue to evolve, and also, although we're seeing numbers that's kind of decreasing, I think with all of us as adults and young adults, it's become responsibility, right? Because we can tell folks every day what not to do, why you shouldn't do it, but we have to take more responsibility, because although we're constantly reminding folks, sending out information on Facebook, on Instagram, I see it every day where people just irresponsible. And what you did, you took the higher ground, right? You didn't go around your mom. You didn't go around your kids. I know how hard it is. There's days that I went home and June can tell you, I stayed downstairs. I didn't want to, I didn't have anything, but I've been around people. I've been to City Hall. And my staff even quite often talk about how we had to kind of like play the role too with the mask and, Dr. Griffin reminding us, wash your hands and don't do this. But there's still folks out there, right, that really don't get it. They're around each other, they're allowing the kids to go around each other, and I quite often say this, right, don't start crying wolf after we've been telling you that Little Red Riding Hood is down in the house, right? So what people have to do is take this thing serious. Because listen, while we at where we at with these decrease, because there were so many people, and thank you, East Orange, who took a serious, took this thing serious, and they did everything possible. Stayed home, covered up, social distance, went out, went back home. That's how this thing, in Jersey kind of, because we had some discipline, right? And it showed your discipline because you knew for a fact if you wanted to. You could have went around Karima, right? You could have, well, Karima probably didn't let you, brother. I always thought you was the tough guy in the house anyway, but I know Karima is really the, the Don up in there, brother.
Amen.
I know she, but that comes with discipline, right? And anything we do, we have to have discipline, because all during this COVID, somehow we all had to readjust, right? I call it, we had to recharge, right? We had to come to a realization that this is here, right? We had to be home. We had to watch how we eat. We had to watch who was around. Our family members couldn't come over. And we had to, and really I always say God was testing us through this whole thing, and he continued to do that, right? But my question also, and I'm going to ask Rachel, do we got any more questions? I'm going to let Dr. Mehta and Dr. Griffin kind of chime in, right? Right now, we are on a little downspill with this COVID-19 and this pandemic. But if you look out throughout the state, people are starting to travel more, right? People are going to the beaches. People are going out of town. People are going on vacation. People are literally coming back from the hottest cities and states that are affected with this COVID, how do we as a city and as elected officials, what should we be doing even more? You know, we're doing a lot. We're doing the best we can to inform people that you have to, and I hate to use this, take a chill pill. You got to chill out and stay disciplined.
Yeah. And so what happened, right? I'm going to drop this quick jewel on y'all, man. It's amazing. I was on the phone yesterday. Something strange. It wasn't strange. It was just enlightening. I was on the phone yesterday with a business provider, and they had me on hold for an hour, and then they hung up on me. I was livid. So I called back, and I got on the phone with a guy who was clearly in another country or somewhere else. He had an accent. I think it might have been, Mexican, right? And so I explained to him. I said, "Listen, man, you just had me on hold, bro, and then you hung up on me. Yeah, I'm trying to get this thing squared away." He said, "Yeah, man." He said, "Yeah, I apologize for that." He said, I'm explaining to you what your situation is rather than transfer you somebody else." And I was like, "Wow, I really appreciate that." And he told me something that was very deep and it's very poignant in what you just said. He said to me, and this was amazing, because it's like you never know where you get a jewel from, like a regular person. He said, you know Darwin's theory of the fittest survive? I said, yeah. He said, throw that out the window. He said, the time in which we're living now, he said, the people that can adjust and adapt are the ones that are going to survive.
That's true.
You know, you see, like my son was strong, the bravado, he was young, vibrant. He had it, didn't even know he had it. He thought he couldn't get sick. I know the people that work out every day, like a good friend of mine who had it. The dude had the same symptoms I had. The dude was strong. He went through the same thing I went through.
Yeah.
And he lost about 30 pounds, right?
Yeah.
And so what we need to do, what we need to continue to do and do more of is be disciplined, like you said, and adapt. And I told my children, it's kind of like a little rough saying, but it's the truth. Eat what you kill and only kill what you need to survive. Meaning that you only do those things that are necessary for you to live a life that is going to keep you safe and the people around you. You don't need to be going out to the mall. My son said, yeah, I want to go out to the mall. These sneakers just dropped. I said, bro, are you serious? You going to put your life online for some sneakers? And he thought about it. He's like, yeah, right, you're right, Dad. I said, order them online and get it.
You guys got to interrupt. I'm sorry, I have to interrupt. We're at the 5-minute mark.
Okay, Rachel.
Well, sorry, I apologize for being so long.
No, that's okay, man. This conversation is really very enlightening. I'm hoping that all of you and those who wasn't able to get their calls in, please call the Mayor's Office of Constituent Services. And if there's some calls or any questions for our councilman, we'll make sure that Councilman Mustafa Brent get those calls and he get back to you either by email. But I'm so grateful that we had this conversation tonight about COVID and those who gave those individuals out there this evening an opportunity to really think about the seriousness of this pandemic. And also, hopefully, that it gave our young people, I'm going to say that again, our young people, and it's just not all young people, some of our adults being a little, right? Because sometimes we feel that we're invincible, but none of us are invincible. I think that we have to take the higher role in what we're doing and take our responsibilities and let's treat it like from day one that we have to stay home. We have to discipline ourselves. And I know everybody probably, before I close out, everybody ready to get out. This has been a task. You know, many of you have been home with your kids. Many of you have been out of work. Many of you have been isolated from your families, and you hear it every day. You hear it every day that we lost someone that we know. And guess what? Maybe we don't know everybody that passed, but guess what? When anybody passed, it's a loss to all of us, right? It's a loss to the community, it's a loss to the families. So I guess tonight, Councilman Brent, we really appreciate all what you said and your experience with this COVID-19, man. And, I wish you well, man.
Thank you, man.
And I really do, and your family. But I'm more grateful, man, that you're sitting here today, because some people didn't make it.
That's right.
Right? So we're very grateful to God and grateful to those who survive, but we also want to also give our condolences to those who passed, and may God be pleased with them. But again, East Orange, very quickly, I want to say I'm going to ask Dr. Griffin to talk about our testing site, and then we're going to close out, right? But we're not closing out saying that we're shutting down, because we're coming back next week also with some more information. We're going to have an opportunity to talking about the reopenings of our parks. We're going to talk about the reopenings of our school district. We're going to have opportunity to also engage with all of you, the importance of our 2020 census. Also, we still have our food distribution, that we're still making sure that all of our residents and folks in our communities are getting food through our Recreation Culture Affairs Department, through our Senior Service Department, our Emergency Management on the other side of East Orange, on Clinton and Springdale. So there's a lot going on in East Orange, but we need all of you guys to stay safe, to stay healthy. So I'm going to ask Dr. Griffin very quickly just to talk about some of our testing sites that's coming up, because people still need to go out and get tested. If you like, it's very important.
We have 5 questions about where to get tested.
Okay, go ahead, Dr. Griffin.
All right, so Councilman Brent, first and foremost, I have to say that it's good to see you.
Yeah, you as well, Doc.
And I think that your story is so poignant, and communicating that to the community, sharing it to the community is important, because sometimes you can say it better than we can say it, right? One of the callers mentioned that there's always skepticism, and it is so important to listen and to hear the stories, to hear what we're saying as far as the seriousness of COVID-19. And while our numbers are decreasing, it's clear that it's also increasing around the country. We went from 19 states being hotspots to now 22, and that's a difference of a week. So we know that there are increases in other areas, people are traveling. So if you have a concern, if you want to get tested, we do have a testing site locally. 161 Elmwood Avenue is our local testing site, and it will be open again on July 24th from 9 a.m. to 1 p.m. East Orange General Hospital is also a resource for you as well, where you can visit the emergency room and you can get tested there. But we also have some other local facilities too. So those are 2 definite places that you can get tested. Feel free to contact us at the Health Department at 973-266-5480 if you have questions or you're having any difficulty accessing testing, because it is important to still be mindful, be vigilant, wear your masks, do everything that we've spoken about before, but most importantly, pay attention to your bodies and know where you stand.
And thank you, Dr. Griffin. Thank you, Dr. Mehta. Thank you, Councilman Brent. East Orange, you heard it tonight. We had a great meeting, great conversation. His testimony should be hitting home to all of you. We're going to tune in next Thursday. Thank all of you for joining us tonight. We're one city, we're one community, we have one goal. That goal is progress. All of us are part of that progress. Let's go, East Orange. That's that East